Have you ever felt an unexplained pain deep inside your abdomen that just won't go away? Or noticed sudden changes in your digestion that left you puzzled? What if these subtle changes could actually be the silent whispers of something far more serious, pancreatic cancer? Today, on Official Senior Health, we're diving into the 6 shocking symptoms of pancreatic cancer that you absolutely need to know. These aren't the usual signs you might expect. Some are so surprising that they could easily be mistaken for something else, and missing them could cost you dearly. Stay tuned, because this video could save your life or the life of someone you love. Pancreatic cancer is known as one of the most dangerous and deadly cancers, and it's often called a silent killer. Why? Because it rarely causes symptoms in its early stages. By the time most people realize something's wrong, the disease has often progressed to an advanced stage. This makes early detection incredibly challenging, but not impossible. That's why recognizing the early warning signs is crucial. And today, we're here to equip you with that knowledge. But before we get into the symptoms, here's a quick question for you. Did you know that pancreatic cancer ranks as the 4th leading cause of cancer-related deaths worldwide? That means it's more common and deadlier than many people realize. Yet, it's also one of the least talked about cancers. So, if you care about your health or someone you know, watch this entire video carefully, because these signs might be staring you in the face right now. Symptom 1. Persistent abdominal or back pain. The hidden agony you can't ignore. The first symptom that many people overlook is persistent abdominal or back pain. But this isn't just any ordinary pain. Pancreatic cancer pain usually begins as a dull ache in the upper abdomen, which can slowly worsen over time. What makes it tricky is that this pain often radiates or spreads to the back, which is why many confuse it with simple muscle strain or arthritis. Why does this happen? The pancreas is located deep in the abdomen, behind the stomach, close to major nerves. When a tumor grows, it presses against these nerves or other surrounding organs, causing that persistent ache. People describe it as a deep, boring pain that doesn't go away even when resting. Sometimes it worsens after eating or lying down flat. This pain is a red flag because it usually signals that the cancer has begun to interfere with the pancreas or surrounding tissues. Ignoring this pain or brushing it off as minor discomfort can delay diagnosis and treatment. If you notice this kind of persistent pain, especially if it lasts for weeks or months, it's vital to seek medical advice immediately. Now, you might be thinking, I've had stomach pain before, it's probably just indigestion. But here's a shocking fact, up to 70% of pancreatic cancer patients experience this pain as an early symptom. So, don't dismiss persistent pain as harmless. Your body could be warning you in a way you never expected. Symptom 2. Sudden, unexplained weight loss. When your body starts losing without reason. Have you ever noticed the numbers on the scale dropping rapidly, even though you haven't changed your diet or lifestyle? Unexplained weight loss is one of the most common early signs of pancreatic cancer, and it's often the symptom that finally prompts people to seek medical help. What's happening here? Pancreatic tumors can affect your body's ability to digest food properly. The pancreas produces enzymes essential for digestion, and when these enzymes are reduced or blocked, your body cannot absorb nutrients effectively. This leads to malnutrition and weight loss, even if you're eating normally. Additionally, cancer can cause your metabolism to ramp up, burning calories faster than usual. This combination means you may lose weight rapidly without trying, sometimes losing 10% or more of your body weight within a few months. If you experience sudden weight loss alongside other symptoms like fatigue or pain, it's a warning you shouldn't ignore. Weight loss isn't just a sign of diet or exercise changes. It could be your body fighting an invisible enemy. Imagine losing 10 or 20 pounds in a matter of weeks without trying. Would you suspect cancer? Most people don't. But here's the truth. This silent symptom has been the first clue for many pancreatic cancer survivors. Don't wait for other symptoms to appear. If this sounds familiar, talk to your doctor immediately. Symptom 3. Jaundice, the skin and eyes that tell a disturbing story. One of the most visually alarming symptoms of pancreatic cancer is jaundice. If you notice your skin or the whites of your eyes turning yellowish, it's a critical warning sign that something is seriously wrong. Jaundice occurs when there is a blockage in the bile duct, which drains bile from the liver to the intestines. Pancreatic tumors, especially those located in the head of the pancreas, can block this duct. When bile cannot flow properly, it accumulates in the bloodstream, causing the yellow discoloration. Along with yellow skin and eyes, you might also notice dark urine, pale stools, and intense itching. The presence of jaundice often signals that the cancer is advanced or obstructing vital pathways in the body. Unlike other symptoms, jaundice is unmistakable and usually pushes people to seek urgent medical care. Here's something that might shock you. In many cases, pancreatic cancer patients first realize something is wrong because of jaundice. If you or someone you know suddenly develops yellowing skin or eyes, don't delay. This is a medical emergency that requires immediate attention. Symptom 4. New onset diabetes or worsening blood sugar control. The unexpected clue. This symptom might surprise you because diabetes is common and often unrelated to cancer. However, new onset diabetes or worsening control in an existing diabetic can be an early sign of pancreatic cancer. Why does this happen? The pancreas plays a crucial role in regulating blood sugar by producing insulin. A tumor can disrupt this function, causing blood sugar levels to rise unexpectedly. This means that if you suddenly develop diabetes after the age of 50 or if your previously well-controlled diabetes suddenly becomes unstable, it could be a red flag. Several studies have shown that new or worsening diabetes can precede the diagnosis of pancreatic cancer by months or even years. Because diabetes is so common, this symptom is often overlooked or misattributed to lifestyle factors. But in the right context, it can be a vital clue. Symptom 5. Digestive problems that just don't add up. Nausea, vomiting, and loss of appetite. Pancreatic cancer can cause significant digestive disturbances. You might experience persistent nausea, vomiting, or a loss of appetite that doesn't improve with time. These symptoms occur because the tumor interferes with the normal digestion process, sometimes blocking the stomach outlet or bile ducts. This can cause food to move slowly or back up in the stomach, creating a constant feeling of fullness, discomfort, or even severe nausea. People often mistake these symptoms for gastritis, ulcers, or other common stomach problems. But when these symptoms become persistent, severe, and resistant to treatment, it could indicate pancreatic cancer. Another digestive sign is steatorrhea, oily or fatty stools that float and have a strong odor, due to the pancreas failing to secrete enough enzymes needed for fat digestion. Think about the last time you had stomach discomfort that just wouldn't go away. Did you chalk it up to stress or a bad meal? What if I told you that for some, this nagging digestive upset was the first warning of pancreatic cancer? Listening to your body and noticing these persistent changes could be life-saving. Symptom 6. Unexplained fatigue and weakness. When your energy just vanishes. Last but not least, unexplained fatigue is one of the most common but least specific symptoms. Cancer drains your body's energy as it grows and spreads, leading to overwhelming tiredness that rest or sleep can't fix. Fatigue from pancreatic cancer is often accompanied by other symptoms, but it can also appear early on its own. This fatigue is different from normal tiredness. It's persistent, unrelenting, and interferes with daily activities. If you find yourself feeling constantly exhausted without a clear cause, especially if paired with any of the other symptoms we've discussed, don't ignore it. So, now you know the 6 shocking symptoms of pancreatic cancer: persistent abdominal or back pain, sudden weight loss, jaundice, new or worsening diabetes, persistent digestive issues, and unexplained fatigue. These symptoms might seem unrelated at first, but together they tell a story your body is desperately trying to communicate. If you or someone you love experiences any of these signs, please don't wait. Early diagnosis is the best defense against this aggressive disease. Reach out to your healthcare provider, get screened, and stay vigilant. Remember, pancreatic cancer might be a silent killer, but your awareness and timely action can be a powerful weapon. Thank you for watching Official Senior Health. If you found this video valuable, please like, share, and subscribe for more critical health insights that can change lives. Stay healthy, stay informed, and take care of yourself and your loved ones.